Welcome. I am Dr. John Stracks. Many of you probably know me. I am here with my colleague, Michelle Grimm, who is a plastic surgeon, physician assistant, and yoga instructor in Durango, Colorado. And we are thrilled to be joining you this evening to talk about mind-body medicine. And so for those of you who don't know me, I am a physician in Chicago, Illinois, who's been interested in this area of mind-body medicine my entire career, from the time I started medical school in 2001 till I joined the faculty at Northwestern Hospital in Chicago in 2009, and then opened my own practice in 2017. This area of medicine has always been my favorite area to practice in, and I opened up my own practice to expand people's access to this type of medicine. I provide individual consultations for people, usually in my office. Now with COVID, I provide them remotely. I have some of my own classes and groups, and I give ongoing support to people who are working in this area. This broadcast tonight is part of the Hope for Healing series that we started about a month ago when we were into COVID, thinking about what we could do that would help people during this time. And so started these every other week broadcasts to bring more information about what we do and how we work in this field, and to bring a variety of perspectives to you about how medical professionals provide support in this area. And so Michelle, as I said, is a plastic surgeon, physician assistant, and yoga instructor and yoga therapist. And she and I have been colleagues for, I think, 4 or 5 years now, and have collaborated when she lived in Chicago, and have done some workshops together in this area. She also, some of you may know her as a curable group leader. And in fact, she has a group that she's leading tonight at 5 o'clock Mountain Time. So she's going to hop off the call at about 10 to 5 her time. I will stay on to continue to answer questions probably until about 5:15 Mountain Time, 6:15 Central Time. Michelle's been a great ambassador for mind-body medicine, and has a little bit different take on how this all works than I do and some of the other physicians who work in this field, which is why I wanted her to be able to talk to you this evening. And in some ways, because of the way she works and her yoga background, for her, it's almost, I would say, more body-mind medicine than mind-body medicine. So we'll talk a little bit about the difference this evening. And I have been convinced for quite some time that we spend a lot of time in this area talking about how the mind influences the body. I have known for a long time the body influences the mind as well. And so when we think about the kinds of treatments that are helpful for people, I think that learning how to work in the body to influence the mind is the next frontier in this field. And so, Michelle, I'm super glad that you could join me this evening. Did I leave out anything about you that people should know?
That was a wonderful introduction. Thank you.
You're
I don't know
welcome.
if I could have said it as well. But yeah, I'm really honored to be here. And I think Dr. Stracks captured this well, that I've been in this world for a little while, but I have been coming from a slightly different perspective. And I do tend to focus on the body and how it can influence healing a little bit more than we'll often find in the mind-body world. And that's been an area of passion for me since I first experienced yoga, really. And I wanted to know how it worked, and it led me down this path. And of course, like so many of us, I also have my own personal journey with pain. And so it was very applicable when I started to experience healing my pain through yoga, that I would get involved in this realm and just dive deeply into it, looking for knowledge. So yeah,
Good.
thanks so much for the intro.
Yeah, you're welcome. So I love actually telling people that you're a plastic surgeon and yoga instructor. Can you talk a little bit about how each of those got started?
Sure. Yeah. So I never thought I would be in plastics, first of all, but I knew I wanted to be in medicine, and I thought maybe I'd be a doctor. But Actually, I had some health issues in college and noticed how I never took care of myself because I was focusing so much on my studies. And the health issues I had kind of freaked me out and made me reconsider what I was doing. And so I kind of walked away from medicine, but I really never could walk away from it in my heart. So I became a PA because it was a little bit more flexible and a little bit shorter path. Well, quite a bit shorter path. And while I was training, I worked in, I wanted to work with women. And I then decided to do a training with a plastic surgeon because he worked a lot with women with breast cancer. And I just fell in love with plastic surgery, mostly breast reconstruction. So that's what I've been doing for the last 11 years now. Recently added in orthopedics, which has been interesting, but a great way to talk to people about pain, of course. But that's how I got into plastics. And then I couldn't really deny these experiences I'd had with yoga. And right about the same time I started being a PA in plastics, I started a yoga teacher training. And it wasn't really until I was pretty far into yoga that I started having some other health issues and noticed that yoga helped so much. And that's how I ended up then training as a yoga therapist. So
Right.
I just keep diving a little bit more and a little bit more in.
Yeah.
Yeah,
I was just doing the math. Did you start at Northwestern in 2009 in the
I
plastic
did.
department? Okay, that was the
Yeah.
same year that I started there too. I don't think I
Oh,
ever
really?
recognized that
No.
before.
Mm-hmm.
So anyway, so you just said that you'd had some of your own pain issues that yoga helped you work out. Can you tell people, would you feel comfortable telling people a little bit about what that was like and how you were able to work your way out of it?
Yeah, for sure. So, it's interesting when you get further into this world, you start to notice all the other things that probably were going along with your mind body syndrome, right? It's not just pain. But the first thing that caught my attention for sure was pain. And actually in deciding kind of what I wanted to say when we were kind of discussing this, I had to think back and really remember, but I went into my first doctor's visit because I was a runner. I used to run to Northwestern from my home. I used to run commute.
Where did you
And
live?
I lived in the South Loop. So it was like a 3-mile run,
Okay.
but I would run to work and run home from work. And I was having just like the most minute knee pain. And I went into a doctor and I was like, hey, I'm a runner. I'm really concerned about my knees. Like, we have to have them be okay. And he was like, I'm not really concerned about your knee. What's going on with your ankle? And I was like, oh, I just have like a tendonitis there, but I never stop running. So it just doesn't go away. And he was like, I'm not sure that's what's happening. And it initiated this huge workup, which found a bunch of things that no one really knew if were causing my pain. But what happened during that time is I also then stopped running because people were telling me it was a bad idea to run, and my pain didn't go away. And so then I just really started freaking out, like, oh, I thought this would go away if I wasn't running. And that really set me off into like, I think it was about 3 years of persistent pain where like I was hobbling every morning, hobbling by the end of the day. I really changed all my activity. I completely stopped running. I moved to swimming. I tried to find things, but it was just, I wrote off so many things that I just couldn't do anymore. I saw 4 different doctors and got 4 different recommendations for what should be done, basically because no one really knew what would help me. And I went to a bunch of physical therapists. I was on and off in a boot for probably about a year and doing different treatments for my ankle without any resolution of my symptoms. And the more time I spent doing that, the more I just kept getting answers of like, we don't know what's going on and sorry, basically. I mean, not even sorry. I don't think I even heard sorry, but um, yeah. So
Do you think that, you and I have talked about this before, and I've heard you tell this story before. Do you think that just the journey through the medical system made it that much worse? Or, I mean, you weren't that in much that pain when you first went to the
yeah.
physician, right?
Yeah, yes. I think it made it way worse. And of course, knowing what I know now, I mean, I can look back and see all the catastrophic thoughts that came to me after seeing doctors. Like, I had a doctor tell me all the things that were going to be kind of hardest for me. And I was like, I'm never going to be able to do those things again. I just went spiraling into a lot of fear about my life being taken away from me. I mean, that's what it felt like the things that I loved doing. I kept hearing them say that those were not going to be possible for me. And so, yeah, actually, since you asked that, I just recently decided like maybe I should check in on what's happening in my ankle and see a doctor, and even just having like a curbside consult, because I work in orthopedics. So I can just ask a doctor that I work with. I totally had a pain flare. So I
Yeah.
know it was that moving through the system really was super hard for me and definitely amplified my pain experience. And that was a big part of what I got through as I've been looking at it more.
Yeah.
But yeah, for sure.
Mm-hmm.
Yeah. So, I mean, that period of my life, I came up with a bunch of like nevers, like I'm never going to be able to backpack again. I'm never going to be able to run again. I might not even be able to be an ORPA anymore because I can barely handle standing. It hurts so bad. Like I would have my foot up on a chair while I was operating so I could be off it. And it was, it was hard to watch that continue to just almost escalate like exponentially, and have everyone tell me like there's just nothing we can do for that. It's just going to keep getting worse. That's the message I kept hearing from my providers.
Mm-hmm.
And interestingly, during that time too, I had to look back at this, but about a year and a half into this journey is when I also started having like unexplained dizziness.
Mm-hmm.
And similarly, just totally thrown for a loop, had a huge workup. No one could find anything wrong with me. I also had like IBS symptoms during that time. So irritable bowel. Yeah. So it was just, it all kind of, when you look back, you can see so much of it kind of building on top of everything else. But what really changed it for me is somehow I feel very lucky for this experience. If anything, because of all of these troubles, I wasn't practicing yoga anymore. And I had started to teach a really subtle type of yoga called yoga nidra, which essentially just involves laying on the floor. And if someone had asked me about that when I first started yoga, I would have had no interest. Like it was not my thing. But all of these troubles I was having meant that's all I could really do in yoga. And I taught a yoga nidra class, and I still so vividly remember coming out after teaching it, and I had absolutely no pain in my ankle, and I didn't have pain for 5 days. And even when I tell the story again, I kind of get the chills because it was so noticeable, like so astounding. And I didn't understand what the heck had just happened. And so that's what got me into all of this additional, trying to look for more knowledge. And actually, for those of you out there who know Dr. Stracks, you might know that he also did a training in a type of psychotherapy. And that's actually how I got connected with Dr. Stracks, is I did that same training, looking for more information on how the mind and body are connected. That was kind of the beginning of my journey. And that's when I really recognized like a lot of the things they're teaching are yoga, like mindfulness, mindful movement, becoming embodied. And so that's what brought me into then a training in yoga therapy. And, I can't say there was like a moment when my pain changed, because I had that 5 days pain free, but it came back. But very slowly over time, it's better. It's just it's gotten so much better. And, for example, I just moved to Colorado, and hiking was one of the things I was told you're really never going to be able to do, or it's just going to be the hardest thing for you. And when I first moved here, I had to post this on social media because I was so happy, but I hiked up a mountain and I ran down it, and I had no pain, and it was just so worth celebrating. So it was a slow process, I would say, but overall I just started finding that I could do things I didn't think I could do. And then when I recognized that, then I would celebrate that. And then it continued to get better. And yoga has always been a part of that. I mean, the things I was doing along the way there were so body-based, like body scans, imagining my ankle happy and healthy, doing movement that was slow and mindful with my joints. These things were all really a part of what was happening during that time, and just kind of getting back into my body in a way that didn't feel scary. Because when I first did my first meditation with my ankle, it was a dark and scary experience. And so I've come back into my body in a safer way. And that's really been what yoga has given me for my experience with healing through this path.
Yeah. And you and I met because I had done training in sensory motor psychotherapy and you had done training. And you have since gone on and done a variety of trainings in yoga therapy too,
Mm-hmm.
correct?
Yeah. Yeah. And so one of the areas that we study quite a bit in yoga therapy, well, in general, we're looking a lot at nervous system regulation. And, but the part that really got me the most was learning about trauma, yoga therapy for trauma, and learning about yoga therapy for pain, which is a lot, those things combine so well. Because we can look at our nervous system states and how the body responds, or how kind of bottom up processing can kind of hijack us a little bit for trauma. And yoga is so good at addressing that. We can work on the breath, we can work on body tension, and we can work on observing that mindfully. And those are all skills that are really encouraged in yoga. And then yoga offers so many resources. Like if I'm feeling really anxious, there are breaths that can help with that. There are practices with your body that can help with that. And then pain, it's similar. You know, I think the more we look at the neuroscience of pain, we know that pain is really about danger, right? So if we can decrease that sense of danger in the body, or in the emotions or in the thoughts, but you know, a lot from the body is what yoga is looking at, then we can really decrease that danger signal and decrease pain. So
Yeah.
it all kind of came together.
Nice. And so you and I have talked extensively about kind of the variety of ways that people can learn to heal pain. And so we oftentimes divide it into top down and bottom up. And so top down is a lot of what I traditionally have done. My colleagues, Dr. Schubiner, Dr. Hanscom, Dr. Clark, who people will hear from in a couple of weeks. And we are good. I mean, we're trained as physicians. We're trained in very cerebral ways. And so we encourage people to really kind of learn about pain, which I know that you do as well, and then to figure out ways that we can use the power of our mind to understand better what's going on in our bodies. And so we can think about pain differently. We can journal write and see what comes up as we write in our journals. We can visualize the pain in a different way. We can learn how to stop catastrophic thinking, which is one of the things that you were talking about, what happened to you in the midst of seeing all these physicians who didn't have answers and who told you. I get so upset when I hear that physicians are telling patients things like, you'll never walk normally again, you'll never do the things that you want to do. I had a guest in my own class last night who said that when he was 40 and threw his back out for the first time, the first physician said to him, all right, no more basketball, no more golf, no more tennis. He's like, what?
Yeah.
It's just, it's so disappointing. And so anyway, so these top-down strategies are frequently how I will explain ways to improve pain to people. Tell us how you think about the more bottom-up strategies, both how you learned about those and then how you have been starting to use them with your clients.
Yeah, so the idea with bottom up, and if you haven't heard that term before, we're talking more about like how you perceive or sense what's happening in the body, how you take in information through the senses, or like a body posture you might hold. So movement, information through the senses, and your sense of the body. And so those things are hugely influential. You know, your nervous system doesn't really know what's going on outside of you except through your senses. And especially when there's potential danger, those things often move really quickly to help you reestablish safety, right? So information from the senses can kind of, like what I said earlier, almost like hijack the next level up. Like, okay, I'm sensing there's some danger. And then now my emotions, I feel fear. And then my thoughts are, I got to get out of here, right? And so the idea with the way I've started to conceptualize pain or using the body for treatments in pain is learning ways that we can use the body to cultivate a sense of safety. And these are things that we often don't really realize are happening. And so the first step usually is just becoming aware of what's happening in the body. Even today, I was driving to work and I realized I forgot my headphones for this call today and I had to drive back and I was going to be late to work. And I noticed that I tensed up in my chest and in my low ribs, and I could feel this kind of anxiety there. And that usually happens, or often happens, without you really even noticing. But it's contributing so much to how your brain is perceiving, am I in danger or not? And so that's kind of the way in I use, is first helping people become aware of what's happening in their body in a way that feels safe. And then also realizing that the body can be a resource. So we can change the body tension, we can address or regulate the breath, we can find movement, and we can choose to find movement in ways that feel safe. And all these things then can really influence the brain and emotions and thoughts. I mean, if you've ever taken like a power pose, like if I stand this way, it might feel different than if you're standing this way, right? So that's how I use this information and use a path of yoga, because yoga offers so many skills in changing the body and breath to help people look at and heal pain.
And we've talked a lot about trauma and how trauma will show up in the body. When I started my sensory motor psychotherapy training, it was specifically to get more information about how to treat trauma, because it's not something that's taught well in medical school, probably in PA school as well. And so I hear you talk a lot about creating safety in the body. And so what are ways that you will work with people from a trauma perspective, and also ways to try to create that sense of safety? How do you think about that when you're working with people?
Yeah, so a lot of the work that we look at through yoga therapy is based on the polyvagal theory. So the polyvagal theory explains how when we're experiencing a threat, we will activate, right? And we're ready to fight or flee. If we get completely overwhelmed, then we kind of go even further, and then we actually drop into collapse. And so a lot of what I'll do using the body is figuring out kind of what your predominant pattern is, like where do you go? And then we try to meet you there and move you back into safety. And so there are some patients or clients I work with that collapse. And this is something that I do a little bit more. And so you have to start kind of slow and activate. You actually have to create some activity in the body. And even, this is maybe more the work of what a trauma therapist would do. But if you're a trauma therapist, you would actually then even take that and look for, your action, like that's your empowering action. I don't do that as much because I'm not a therapist, but what I do is try to cultivate like, oh, I can, embody my body and be safe. I can get out of this collapse and I can experience something else. And what that really offers is kind of empowerment, right? Being able to realize that you have the capacity to change your state. Because oftentimes this feels really startling. Like I didn't even realize this was happening, and now I can't think straight, or I can't breathe. I'm so anxious, I'm shaking, and these things can kind of take people over. In the trauma world, of course, we call that a trigger. Like you've been triggered, and that's really that bottom up hijack. And it can feel really powerless because you don't really understand what's happening. And so we can meet that state and then teach people ways to kind of get back to what I call center. But if they've collapsed, we need to activate and then come back down. If someone is really activated, we just need to calm, right? So that's kind of a broad way of explaining it, maybe also a little bit technical, but that's kind of what we can do, is we can teach people that they can change their state, the state of their body. And then that ripples over, and you'll see people say, oh, now I believe this about myself, or I feel capable again, or I now feel love or joy, or these higher states of emotions, right? When we can kind of change the state of the body.
Mhm. And, I trained in both level 1 and level 2 of sensory motor psychotherapy. And so I do a little bit of the trauma work with people. And
Mm-hmm.
like you said, we are in that kind of therapy, which I think works really nicely with people who are working in mind body medicine. We're looking for where the tension is held in the body. And oftentimes, as you said, what people wanted to do with that tension that they didn't get a chance to do in the moment. And so frequently we'll find that people's reactions to try to protect themselves, say if they were in a car accident or a bike accident or were mugged. And oftentimes, like, you can tell that their bodies got stuck in a certain way. And if you pay enough attention to the subtle cues, you can start to sense that their body wanted to sort of push out
Mm-hmm.
this way or kick away the person who was with them. And so it can be really helpful to free up some stuck energy and
Mm-hmm.
and to free up what feels like pain, which is really that energy that's dammed up with nowhere to go.
Yeah, and I mean the thing that's really interesting about trauma is that we know there's kind of a trauma cycle, right? Where we recognize threat, we orient to it, then we take action, and then we reestablish safety, right? And if that gets interrupted at any point, it doesn't really ever get cataloged as done. And so our brain kind of holds on to it as, no, we're still in danger. This isn't complete. And like I said, our understanding now of pain has really become that it's a danger meter. So if we're holding something as incomplete and we're still in danger, like, for sure it contributes. And so yeah, completing, I did a lot of work actually during my own healing journey with a somatic experiencing therapist, and we completed all kinds of actions.
Mhm.
And it was so freeing. It felt, it lost its charge. Something that before felt really scary, and even if I thought about it again, it would make me feel fear, or I would feel the tension in my body. It just didn't have that charge anymore. I could talk about it. It still was real. It still happened. But it didn't pull me as much. And so it's a really cool thing to see, for sure.
Absolutely. You lead some of the curable discussion groups, and so you're involved, as I am, with Curable and all the great things that they do with their app. I would say that I would define Curable on the top-down method for the most part, learning about pain, doing the journal writing, meditation is a little bit of both. How do you put together, how do you see, I think more importantly, the people who are listening out there, how do you see them being able to incorporate both directions for optimal healing?
Yeah, I think, that some of the material that came out of kind of what's how Sarno kind of started this for us all, right, was maybe more of suggesting like a denial of the body, not denial, but like you're going to overpower the body with your brain. And I do believe we have the capacity to do that. But I think the body also has a lot of capacity too. And so the way I generally frame this is, again, just looking at it as danger. Wherever your input is coming in, that there's danger, let's work there, right? So if the input's coming in from the body, let's work there. And usually there is a component of that, just like there's going to be an emotional component or a thought-based component. And so, I've had people have great success with going out, let's say, on a bike ride, which they thought they never could do, and telling themselves they're safe, and they do great. I know, I know. And I've actually had another client with a similar story, but it always makes me think of you. But then I've also had people where that doesn't work. And then we look at what's happening, and, they're riding their bike like this. So, okay, can we let the shoulders relax? Can we experience the breath moving as you move your body in this way? And so I don't think they're in opposition at all. And I think I do get that question sometimes, like, hey, I've always been told that, like, I can just think my way out of this. And I'm like, okay, well, your thoughts are important because they contribute to a sense of danger, but so is your body, and so are your emotions. And so I like to integrate it all, and yoga offers that. I mean, the whole idea with yoga is that we work through the different layers of being. If you're really into yoga, you'll know about the Panchamaya Kosha model. And so we
What's
settle
that?
the, yeah, Sorry, that was a big word, but it's
Okay.
called the Pancha Maya Kosha model. And the idea with that, it's the 5 layers. It's the 5-layer model and the 5 layers of being. So we work through the body first, because if your body feels crappy, you can't really think well, right? So we work through the body. Then we work through kind of like this energetic or breath level. And then we start to get into the more subtle, like our personality or our knowledge. And then we'll drop even lower into kind of this like deep knowing, or we call it the bliss body. And so what it does is it works through each level. Like we do work with the mind, we do work with the personality, but we work with the body a little bit more first, then we go there. And so it gives a model for really looking at all those levels, and just acknowledging how we're so integrated. Like you can't separate these things. You can separate them to maybe come up with strategies, but ultimately, if you do one, it's going to affect all the other levels, right? And that's what yoga really offers in a really beautiful way.
I had a conversation one time with Anat Banyal, who's like, she was the direct descendant of Moshe Feldenkrais, who does the Feldenkrais method,
Mm-hmm.
which ties into a lot of what we talk about. But I was talking with her about this concept of mind body, and she said, no, that implies that they're 2 separate things.
Mm-hmm.
We need a word that sort of
Yeah.
understands that there's no separation. Emotions, I talk about that regularly. I know that that's a big focus of the curable groups and the curable
Mm-hmm.
app. How does what you do help people tap into their emotions? Because that's oftentimes what I see, is that a lot of people come to me who grew up in families where emotions weren't really allowed, or were
Mm-hmm.
shamed, or were taken away from them. And so how does the work that you do help people get in better touch with that, so that they can both recognize them and even allow themselves to have them?
Yeah. So again, because I'm pretty body based, I tend to think of emotions as a feeling that happens in the body. And then an emotion is kind of like our interpretation of that. Or you can think of it as the way we color something, like this is important. And so we have an emotion about it. And so the body work helps with that. I mean, I've seen people just become more emotionally aware just by becoming more bodily aware, or learning ways that they can augment their body or change their breath. And so there's that part. And then the other part too is that emotions, because I kind of think of them as coloring a situation, right? If something's important, you have an emotion and it kind of alerts you to it. And so generally, many emotions can feel kind of dangerous, right? Because there's something important going on. And usually, if something's important, it's important because it's important to our survival or safety. Um, and so it can feel dangerous to feel those feelings. And so a lot of what I'll do is, again, cultivating, like, can we, there's some principles I'll use, but do I feel safe? Can I keep looking at this? Can I relax my body and my breath? And then we just look. And generally an emotion, if we start to become more in tune with the way our body feels, we'll notice emotion more. And then once we get more comfortable with staying safe in looking at it, we'll kind of get its message, right? Like, so the emotion's trying to tell us something that's important. Well, what is that? And then you can actually access that message rather than just being completely overwhelmed by the feeling or the emotion. And so it's a lot of this work, you know, in contemplating again how we would talk about it, it's subtle. It's not like I did this one thing and it solved all my problems. That was never the way my path was. It was always very subtle, and it would be with practice, I'd notice little things were better. And then over time, my pain was better. But it's subtle. It's not linear. And as a PA, and I wonder if you struggled with this too, Dr. Stracks, but you know, I wanted everything to be linear. Okay, this is your diagnosis, this is the treatment for that, and now it's solved. And it's just not that way with pain. It's too integrated and it's too complex. And so it just can't be linear. And each day too, different things can contribute to why you might feel danger, which means why you might have more or less pain, right? And so Whereas yesterday it could be, or today it could have been that I was late for work. Yesterday it could have been that I just moved to Durango and I'm missing my parents or something. You know what I mean? So there's a lot there, that it's constantly kind of ebbing and flowing. And so it's just not linear. It's more subtle. And yeah.
Yeah, I'm actually a fairly non-linear person, especially for a physician. Like
Yeah.
occasionally I'll think about various pathways that I could have taken. And I was like, why did I do my residency in Michigan? And I'm like, oh yeah, we had to pick up our son there who was born during my third year of medicine, right? Which is a totally non-linear concept, but it
Mhm.
works for me. It's interesting though, because like I get asked all the time by people who are on this pathway and not feeling better yet, feeling a little bit better. Like people get really embarrassed that they didn't end their pain in 20 minutes, like stories that they
Yeah.
read in books. And so I spend a lot of time telling people that, yeah, this is how pain gets better. It's little bit by little bit. There's ups and downs to it. There's
Yeah.
backs and forths to it. And part of getting better is understanding that on days when you're feeling worse than you were the day before, it doesn't mean that you're all the way back to the beginning. It's just that you're taking a little bit of break. There's some up and down to it. Or sometimes I tell people like you need that dip in order to get the momentum to get to the next stage. And so I think it's nice for people to hear you talk about how like that was what the journey was like. There wasn't any one moment that you recognize that you're out of pain. There's a really nice curable podcast, I think last month with Laura and Christy Weepy, who used to work at the Pain Psychology Center and now is running United Healthcare's group out in Las Vegas. She had the top 5 lessons that pain patients will learn, one of which was there is no moment when you're out of pain. And I describe it to people sometimes as you wake up one morning and you think like, oh, it's a bad day. Like I haven't had one of these for a really long time. Or it's a bad day and this is like better than good days used to be. And that I think is a lot more of people's experience than just sort of like finding the answer and snapping out of it. I'm going to have you,
Yeah.
go ahead.
Oh, I
Go
was
ahead.
going to say the thing I would add to that too, and maybe you found this too, but when I have down slumps now, which still happen, it now is a reminder that I need to practice, right? So, and not just practice yoga. I mean, yoga is my path, but there are so many parts of that. Like, what is it I need? It's like a reminder to check in. What is it I need? And that doesn't mean that I do it and my pain goes away immediately, but it means that I take care of myself and overall I'm still going up, you know? So yeah, it's changed. Whereas before I would drop into like what you said, I'm back to where I was and this is never going to be okay. I've started to have a little bit more softness and flexibility and now also regroup like, okay, I just need to help myself right now.
Yeah. Christy actually referred to it in those recent podcast as she said her body sticks up for her when,
Yes. Yeah.
when our
Hmm.
bodies know what we need, even if we
Yeah.
don't, like they
Yeah.
let us know. And
Yeah.
we so appreciate that, which is it's a
Yeah.
hard concept to understand when you're first starting. But as you go along and as you see the results, you start to recognize just all this wisdom in the body, even when it's showing up as pain. So in a sec, I actually want you to lead us through a short exercise. One more question that I have for you, though, that we've been talking about is this concept of trying softer, which I was just, I think about this regularly, and I was looking at something the other day. I think it was talking about panic attacks and how like we can't make ourselves relax because the harder we try to relax, the tenser we get. And
Hmm.
so you have thoughts about this concept of trying softer, which a lot of us have been talking about over the last few months?
Yeah, I actually have kind of maybe two different approaches and thoughts on that. One is my sister actually sent this to me and I've used it before, but it was this meme that said, I had to write it down here. Never in the history of calming down has anyone ever calmed down by being told to calm down. And so it's that speaking to that idea of like trying so hard to tell yourself to relax is like the opposite of what you need to be doing. And that's why, again, I think the body's a nice way in for that. But the other thing too, and it actually maybe brings me back to who you had on last time. I think your last one was with Jessica, but compassion has been a huge part of being softer. And I think that comes in, it tends to come in naturally when you soften the body and the breath and you just stop trying so hard. Like that's what happened when I was in a lot of pain. All I could do was yoga nidra and yin yoga. And like, I would have never done that before. I would have pushed through. I would have been like, you know, F that. I'm going to keep going. Right. And I couldn't, I just really couldn't. And so I learned about softness. Now I still have to remind myself of that because I like to go 150 miles an hour all the time. But yoga really encourages that because it encourages you just showing up for what's there instead of trying to push yourself into something. And that's more of a therapeutic yoga approach. That's not really the popularized yoga you'll hear about where you see people in all these pretzel shapes. But it is really what yoga is showing up for what is, accepting it, and then staying, right? And then seeing what happens next, basically. And generally, the answer for your healing comes through that process instead of trying to push for an answer or pull or grab for an answer. And so yoga, again, kind of subtly teaches that by just being in your body, being with your experience, and noticing that it's different today than it is, you know, was it yesterday, and all that stuff that comes along with checking in regularly, you know?
It's such a non-Western concept. I mean, we've spent so much time in this society pushing and doing and getting there faster and better and further. And I talk with a lot of people for whom, like, you know, part of the issue in this society is that works. Like, that's how we get to a lot of the places that we get to. What I find with health issues is that that strategy oftentimes doesn't work. And then people who have used that effectively, used the pushing effectively over the course of their lives, find themselves in a health situation where that doesn't work and then need to find new strategies that are more effective. So
that definitely captures my path.
yeah. So anyway, I'd like you to lead us in a short exercise. Before you do, you need to leave at about probably 5 till, that's 4:45 Mountain Time, or 4:55 Mountain Time, 5:55 Central Time. I will stick around for a little bit longer than that, probably until about 15 minutes after the hour, to continue to answer questions. And so people are listening. Some people are listening here on Zoom. Some people are listening on Facebook. If you're on Zoom and you have questions for us, there's actually a Q&A button that you can type into at the bottom of your screen. If you're watching on Facebook, you can type your questions into the chat box and our colleagues from Curable will carry them over here to Zoom so that we can see them. And so I'll answer as many questions as I can until the time's up, and Michelle will answer them too until she needs to go. So anyways, can you lead us through a little activity?
Yeah. So as I said throughout this conversation, this can be subtle, and a lot of where we'd like to start is building awareness. So I'll lead you guys through a little bit of a body and breath awareness practice. And just know that there's no way to do this wrong, right? This is more of an exploration, and there's no good breath, there's no bad breath. It's really just a way of noticing what's there. So to start this practice, we'll just try to elongate the spine and just let your hands rest on your thighs. And if you're comfortable, just allow your eyes to close or your gaze to drop. And so the eyes can relax a little bit. And if you're feeling kind of up in the head, or you find you're thinking about a lot of things, just maybe first gently draw your attention to something you can feel in the body, like where you're supported, like where your sits bones hit the seat underneath you, or where your back is supported by your chair behind you. And just feel then the weight of your body supported. And let your body somewhat melt into that support and just feel a sense of being held. And now gently draw your attention to the breath without changing it at all. Just notice the breath. You might notice a sense of coolness at the nose or mouth when it comes in. Or notice the way the chest or belly expands as the breath comes in and then gently recoils as the breath moves out. And just take note of the breath, again, without changing it or judging it. Just notice how it moves. And again, without changing the breath, we'll start to explore a little movement as if the breath is causing the movement. The next time you inhale, just let your chest lift a little. So the chest will lift up and forward through the shoulders. And as you exhale, then it can kind of drop back to where you started. And let the breath lead this movement. So it feels as though the breath is actually causing the movement to happen right at the heart space. A gentle lift when the breath moves in, and a soft sense of drawing in as the breath moves out. And just start to follow then kind of the ebb and flow of the body gently moving with the breath. And as you continue to breathe in this way, just notice, is the body leading the breath? Or is the breath leading the body? Allow the breath to lead the body. And now start to allow that movement to get a little bigger. So each time you inhale, the chest might lift a little more. And as you exhale, there'll be a little more drawing in. The back of the body might even round. So if you've done a cat-cow before, you'll start to experience a little bit of that. Where as you inhale, we find this little back bend where the heart lifts. And as you exhale, we round the spine back behind us. And each breath, maybe allow this movement to get a little bigger. So we really start to feel the way the spine can move, ebbing and flowing forward and back. And remember, there's no way to do this wrong. This is a way for you to explore the body moving with the breath. Let the movement start to get as big as you'd like, exploring how much the spine can move. Still here, moving with the breath. And you might even find that your arms want to come wide as the heart lifts, and that's also fine too, letting the shoulders open up a little more. And now let this next breath bring this movement as big as you'd like it to be. And then over the course of the next maybe 5 to 6 breaths, we'll start to again let the movement get a little smaller and smaller. So we'll come back to that subtle movement, but over maybe 5 or 6 breaths. So each breath, a little less lift, a little less drawing in. So then maybe in the next 2 breaths, we'll come back into stillness, just noticing the breath move, and maybe even just that kind of reverberation, that rhythm you can still feel of that gentle expansion and drawing in, like the memory in your body of that movement as the breath moves. So even here, as you breathe back in stillness, your body still expresses this natural expansion and contraction with the breath. And for our last couple breaths together, maybe bring the hands to the heart. So right hand on the heart, left hand over top. And just feel the way bringing the palms to the body can feel nurturing and grounding. The hands giving the heart space support, and the heart also gently lifting to fill the palms. And then when you're ready, we'll let this practice go. And take your time in opening your eyes again, and we'll come back together.
Thanks. That was great.
Awesome. Yeah, you're welcome.
That was great. That one thing that I totally noticed in there, which I knew before, but just the slowing down and paying attention, right? So often pain is just like, it's so intense and so white hot. And when we can slow down and take a peek, I was thinking oftentimes like we recognize that it's not as just overarching horrible as we think it oftentimes is. And then what you were saying earlier, we slow down and look and we can find that there's a lot of meaning in there. Like it's not, I say frequently, the pain's not there to make our lives miserable. The pain oftentimes is trying to make us aware of something we need to know. I don't get migraines anymore. And over the past, since I learned about mind body medicine 20 years ago, I've had one, and it was after a long, long bike ride, and I had overhydrated. And the first thing I thought when I got it is like, oh, I know what to do. I'll just tell it to go away. And so I did, and I vomited. And I was like, that's not going to work. And so I breathed and I watched. And as I did that, like recognized, like it wasn't just an ice pick going through my eye socket. Like there's a rhythm to it, and a flow to it. And over time, like it flowed out for a little bit longer, and it wasn't an intense, it came back in, but I had to slow down.
Yeah.
Do that.
Yeah, and interestingly, we know this, but that output of pain or that protective measure of tensing up then becomes an input, and it just kind of makes it worse. But if we can stop and look, it can often kind of interrupt that. And I have had patients or even myself have experiences where you almost feel like a little blip, like, oh, it wasn't there suddenly. And you start to slowly watch it kind of unwind. Yeah, so the slowing down is a great thing for sure.
So I know you need to get to your group in a couple of minutes,
Yeah.
and I know some questions are starting to roll in. People here on Zoom are typing them into the question and answer box, and
Mm-hmm.
some people on Facebook are asking too. If you have time for just a couple of people have talked about, like, how do you get started? Like, if you're interested in yoga, you haven't really done it before, how would you know how to get started with this?
Yeah, I mean, I think for the average person, going to kind of more of a restorative type yoga is going to encourage more of these skills that really prove helpful. So, gaining skills in breath and body awareness, and then how to regulate it. I think that happens a little more in a yin style or a restorative type of class. So that's often a really good place to start, but it isn't always a good fit for everyone. And so it can require a little bit of exploration. And anytime, obviously I'm a yoga therapist. So anytime you're looking for specific input, you want to talk to someone who does this a lot and can talk to you about what exactly is happening with you and what might be a good match for you. But even with that, it's exploration. And so keeping openness and curiosity is something I always talk to my clients about. And I'd say the same thing about exploring yoga. But the more direct, guidance you're looking for, then yeah, work on one-on-ones. It's a great place to start. You'll get a lot of information.
Yeah.
And that's a lot of what I do then too.
And then somebody else asks, like, they're interested in yoga and trying to get back into it, but even the beginner's class sometimes is too painful. Do you
Yeah.
recommend like trying to work through that pain, or is it okay to dial it back to any point where it's comfortable?
Yeah, so there's some specific ways I look at trying to move in the setting of pain. I actually just launched a course that talks about this, but it's the idea that we would apply certain principles to figure out how we can move in safety. And so like a pain-based yoga class should work with that. But pain is not necessarily what we should be listening to decide how to change movement. It's about feeling safe. And we want to feel safe not only by saying, I'm safe, like I can say that to myself, but also feeling that the body is relaxed and the breath is relaxed. And so those would be kind of like my quick pointers for that. But also, if you want more information, please feel free to reach out to me. But there are lots of ways to apply that and find movement or strategies for movement that you could take to any class, right? So now that I know the strategy, I can go to any class and employ them, and it will be more therapeutic for me.
Thanks. Any last thoughts before you go to your group?
I don't think so. I think this was really lovely. We covered a lot of really awesome material. So thanks so much for the thoughtful questions. And I can't obviously see everyone who's here watching, but I'm so happy that we got to spend this time together, and hopefully you heard something that will inspire you in your own healing journey. Yeah.
And so if people want to reach out to you directly and find out more about what you do or the kind of consultations that you provide, how can they find you?
Yeah, so I have a website. It's embodiedhealth.co. So it's not .com, it's .co. And also on there, if you look under services, you'll see the courses that I'm currently offering. So if you guys are looking for kind of a place to start that you can do on your own self-paced learning, I have some courses there that are more body-based. And also there's a contact page on that website where you can reach out to me with any questions or set up a consult, whatever you'd like. I have a free 20-minute consult too, if you just want to connect about what's going on with you.
Great, great.
Awesome.
Thanks so much for being here. It's
Yeah.
so good to see you. We miss you in Chicago.
No, thanks.
Let me know when you're here next.
All right, I will. Yeah, really nice to see you too, Dr. Stracks.
All right.
Okay.
Have a good night.
Bye. You too.
I will stick around for 10 or 15 more minutes because I know there are other questions that have come in. And so let me try to answer a few that are here. And so somebody had asked about sleep, and I frequently feel like TMS or mind-body medicine principles are relevant to sleep. And so there's a sleep book that I like that was written in this vein called The Effortless Sleep Method. And that's oftentimes what I will help people move towards when they're worried about or when they're working on sleep. And so sleep is a lot about getting our bodies relaxed enough to drift off. And there's also, I think, sleep hygiene rules are helpful too. And so I try to get people to get to bed at the same time and wake up at the same time and only be in bed if they're sleepy, and not try to fight through sleep, and especially to learn relaxation practices that are helpful for them. And so along the lines of what we were just doing with Michelle, I also think that our narrative matters. And so I encourage people to start telling the story both to themselves and to other people about what great sleepers they are. We so often follow our narratives, whether we're talking about pain or sleep or other health conditions. And so just have people talk about how they couldn't sleep and now they can, and they learned how to do it. And so those are some of the pieces that I try to put in place when people are suffering from insomnia and having sleep issues. And that book that I like is called The Effortless Sleep Method by Sasha. I think at this point she's got a program too that she leads people through. The next question here: able to do many of the activities that are great, but after the activity, the pain level goes down to 2, and then up to 8 or 10. And so it's not unusual for people to find that they have more pain after an activity than they did before. And that doesn't imply that there's a physical issue going on that needs to be addressed in a physical way. It's still a mind-body issue. And what I would say is that, like we were just talking about, staying calm when that happens is an important part of getting better. And so if we do an activity that we like and the pain ramps up, being with it, being in that space, calming down our brain. Oftentimes we can calm down our brain, we calm down our body as well. Another thing that I will talk with people about regularly is that we need to kind of be aware of how quickly we're jumping back into exercise. And so I know there's a lot in there about like stopping physical treatments and just jumping back into exercise. But I find a lot of people will really benefit from moving slowly into the things that they like to do. And so I was talking with a patient fairly recently, and we were talking about this topic. And she was saying that she, for years, has gotten exercise by treading water in a pool with her mom. And she said she did that recently and she finished and it was so painful. And she said she had just done it for an hour. And I thought she was going to say she had just done it for 5 minutes. And so we had this conversation about how to move back into exercise in a reasonable way, because as we jump into things, oftentimes it will ramp up the soreness that we get, which feels alarming. And so I frequently will counsel people to go back maybe a little bit further than they think they can, but not try to jump into a 100-mile bike ride if you haven't been riding your bike at all. And so that's something else to think about as you're trying to figure out how to bring exercise back into your regimen. Next question here is about facial pain. It's being managed well with both medication and curable. And is there a good book about trauma and the mind-body connection? There's been a lot of trauma in this person's life. And so there's some great information out there about trauma and how it works its way into the body. The two resources that I like the absolute best are, number one, the book The Last Best Cure by Donna Jackson Nakazawa, who actually has a new book out that I haven't read yet, but she's gotten 2 books about how trauma ends up in the body. And that one, The Last Best Cure, is a really nice description about how she came to recognize the role that trauma played in her own health conditions, actually an autoimmune disease, and what she researched about the state of what we know about trauma, how people experience it, how it works its way into the body, and then how people can heal from it. The other one that I really love is Bessel van der Kolk's book, The Body Keeps the Score. And so he is essentially the world's expert on trauma and the treatment of trauma. And this is really about his life's work in this area. And again, what he's learned about it, what people can learn about how their own experiences show up in physical ways, and then multiple chapters in there about what he's learned about healing trauma and what types of different modalities will help to do that. Another one that's not as well known that I really like is a book that's called Insight, and the subtitle is The New Science of Post-Traumatic Growth. And we've learned over time from research that over half of people who've experienced trauma will, on the other side of the trauma, say that they're better off for having gone through it, which seems kind of insane at first glance. But then you think about it a little bit and you can see how that growth happens. And so now that we know that majority of people experience that, we're working on what helps push people in that direction. And so that book Insight is about the research of what helps people heal from trauma, and more than just heal, thrive on the other side of these experiences. And so those are some of my favorite resources about trauma and the mind-body connection. The next question here: after a meditation or an exercise like we did with Michelle, if emotions come up and sensations come up, what are next steps? Is journal writing a good way to deal with that? Absolutely, journal writing is a great way. And so a lot of people will keep their journal with them when they're doing yoga or meditation. The other direction is helpful also. And so a lot of people will journal and then meditate and see what comes up after the meditation. Our colleague Nicole Sachs oftentimes recommends that to people. I think also being with the emotions. And so I had mentioned earlier Sasha Stevens and her book, The Effortless Sleep Method, and we were talking about sleep. And so she talks about how one of the best relaxation techniques is just to sit and be and see what comes up. And so I would say that that's an answer that we can give to this question too. We do these meditations, we sit, we do the yoga exercises, and then as emotions show up in our bodies, if we can let them be there, then oftentimes they will come up, we'll feel them in our bodies, there's an emotional release, and then we're able to move on. And oftentimes that happens in like 30 to 90 seconds. And I've been asking everybody during this coronavirus time, what are your hidden benefits of quarantine? And so one of my big ones is that I've been doing yoga online with a studio in Chapel Hill, North Carolina called Thousand Petals Yoga. I've been doing it almost every morning, and I get into some of the more intense poses and the emotions just start to bubble up, and I just try as hard as I can to let the emotions be there, to not judge myself for having them, to let them come out in my body, whether it's crying or trembling or shaking, and allow that to be okay. And so that, I think, is one of the best things that we can do as these start to bubble up in our body, is just to watch them, welcome them, allow them to be there, and not feel like we need to push them away. Next question: have specific types of therapies or approaches been shown to be helpful for specific types of pain, bone pain, nerve pain? I would say that I don't know that we have mapped that precisely yet to say that these specific types of approaches are good for fascial pain or nerve pain. And so I think I've seen a lot of people respond to a lot of different modalities over time. I don't think yet we have the knowledge of which modality works for which specific person. And so that's why I encourage people to try a lot of different approaches and not necessarily think that there's one or two that's going to work for them. And so different types of psychotherapies can be helpful, different kinds of movements can be helpful, different kinds of journal writings, different kinds of meditations. One of my patients who has done really well over time had this idea that he was going to fail quickly with as many modalities as he could get his hands on. So he would try them, he would see if they resonated resonated with him, if they felt well. If they did, he would keep them in his repertoire, and he would go on to the next one. And so I don't get too wrapped up in trying to match the precise treatment with the precise person. I think when I'm working with somebody individually, we do that as best we can, but we also know that we won't know ahead of time what's going to work best until it's tried. Next question here. How would you guide or help a loved one living with chronic pain with the mind-body tools when they don't believe in them or don't work with them? And so I get this question all the time from people. How do we talk with other people about this topic? And so I was talking with one of my patients earlier today that I generally say that people are ready to hear this information when they're ready to hear it. And so when we talk with people who are near us, I'd say somewhere between 1 and 10% are ready to hear this right away. And when you think about all the people in the world, right, the hundreds of thousands of people who have found their way to curable, that's a lot of people. But when you're talking about the one person who lives with you, they may or may not be ready to hear the message. And so I frequently tell people, like, we get out our own stories, we get out our own experiences, we give resources to people who we love and want to know about it. Ultimately, it's not our responsibility to make them latch onto it. And so one of the things that we talk about in my practice in curable groups is having good boundaries in place. And so knowing what belongs to us and what belongs to other people. And we can take our story and we can offer it to the people who are near us, who need it. And that's what we can do. And then it's their responsibility to take it up and work with it if they want to, or decide that they're going to put it down. And if they put it down and continue to have pain, that's their pain. And as hard as we can try to let them have their pain and not make it be our pain. And so the straighter we can keep those boundaries, the more we can know what's our responsibility and what's other people's responsibilities, I think the easier that conversation goes. And oftentimes, right, the dynamic is the more we push, the more people will push it away or pull away. And so we can offer it, say, here's what we know, and then we can allow people to take it or not as they desire. Couple more questions that are here, and then we'll wrap up in a few minutes. What can we do to increase our body's feeling of safety just in everyday's life? And so some of the things that Michelle was talking about, getting to know our body, getting to learn what's going on in our body. And so spending a few moments each day sitting, paying attention, coming at our bodies from a place of curiosity, coming at our bodies from a place of kindness. I say regularly, the pain is not the enemy. The pain is just trying to push us in a direction that it wants us to go. And so if we can sit even for 30 seconds, even for a couple of minutes, and notice what's going on in our body, be non-judgmental, be curious, we start to get a sense that the pain is not there to make us miserable. And as we can get a sense that we can be in our body and the pain ramps down a little bit, that helps to create the safety that we're looking for. I definitely have a physical problem. Can you reduce the pain if there's a serious physical issue? Absolutely. And so we were talking about this last night in my group and in other groups that we've been running. And so there's always, to all kinds of pain issues, a physical component, a psychological component, and an emotional component. And so in all cases, if we work on the psychological and the emotional side, we will see the pain start to reduce. What I find in working with pain is that oftentimes that physical component is the physical component is much less of a piece of the overall story than those psychological and emotional components. seem to be. And so I say, even if there's a physical issue there, no matter what it is, getting started with these ideas and techniques and conceptions and moving forward with healing on an emotional, psychological, non-physical level, oftentimes we start to see the pain better. And then oftentimes we make a lot bigger strides than we think we would. One of my patients who's done so well over time has gone from 200 migraines a year down to like 2. Said that when she first met me, she wanted to get 20% better. So she said if she could go from 200 migraines a year down to 160, that would be an incredible win for her. And she started working on this. She took my class. She did a mindfulness-based stress reduction class. She got a sense of how to talk with the migraines so that they weren't so scary, and went so far past that 20% better that it's amazing to hear what she has done. And so those are the questions here. It's just about 6:15 in Chicago. And so I will wrap up. Thank you so much for being here with us this evening. Thank you for your attention. Thank you for being brave enough to work on your health issues in this mind-body way. It's amazingly effective. It's, as you know, it's countercultural, but I am always inspired and touched by people who will enter into this space and say they're going to take charge of their own healing. They're going to use the tools that are available through my practice, through Curable, through Michelle's practice. And so many of you have a little progress, a lot of progress, but as long as you are working in this area, you are gonna see progression. I am, of course, available for consultations for anybody who would like. You can go to my website, www.drstracks, that's drstracks.com. You can contact us. You can talk about setting up an appointment. You can sign up for our newsletter so we can stay in touch with you. And my intention is to continue to offer these Hope for Healing sessions. In a couple of weeks, we're hoping to get Dr. David Clark, who wrote They Can't Find Anything Wrong, and continue to find people with expertise in this area that you can tap into to aid with your own healing. Thank you for being here this evening with me. I hope everybody has a great night and wish you continued best on your journey in this way. So have a good night, everybody, and I will see you soon.